Assalamu alaikum and welcome to this week's Journal Club, where I'll be talking about a paper published in the Journal of Dental Traumatology by Haupt in 2023, titled Survival Analysis of Fragment Reattachments and Direct Composite Restorations in Permanent Teeth After Dental Traumatic Injuries. So the purpose of this study was to evaluate the restorative and biological survival of reattached fragments and direct composite restorations after crown fractures in permanent teeth. And the study also aimed to identify potential variables that affect the survival. So the sample size, the study retrospectively analyzed data from 164 patients with a total of 235 teeth. Of these teeth, 59 were restored with fragment reattachment and 176 with a direct composite restoration. The retrospective analysis of dental records was from 2000 to 2018, and they recorded the survival and any restorative or biological failures of the restored teeth. And survival was defined as no further intervention until the last review date. And restorative failure was recorded if the fragment deattached or if any of the composite restoration surfaces had to be restored again. For the biological failure, it was noted in cases of negative pulp sensibility test, followed by endodontic treatment or tooth extraction. And moving on to the results, the overall mean observation time was from 1.5 years to 2.5 years, and the overall survival was in composite restorations had a significantly higher survival rate than fragment reattachments, and the cumulative survival after 2 years was 65% for composite restorations and about 43% for reattachments. There were several failure types. First, restoration failure and biological failure. Biological failure was termed as pulpal necrosis, and they were significantly more frequent in the reattachment group compared to the composite restoration group. For the risk factors, firstly, for composite restorations, a luxation injury and the lower jaw decreased the risk for failure, significantly influenced survival. For reattachments, the time between trauma and treatment and the adhesive application mode were significant in the analysis. So in conclusion, the study concludes that both restorative and biological failures occurred more frequently when teeth were restored with the reattached fragment compared to a direct composite restoration. And the authors emphasized that pulpal necrosis is more likely to occur with a concomitant luxation injury. And given that most complications for both restoration types occurred within the first 24 months, this study highlights the necessity of regular short follow-up intervals for the first 2 years after a traumatic crown fracture. Thank you very much.